Eric's going to stay here with Jody. Yeah. And we'll go to questions in just a second. Just a few more bridging comments. Those of you who've been following the work of this forum, this relatively new forum, know that the first two workshops were focused specifically on interprofessional education. And I'm delighted that the publication summary of those first two workshops is now available. It's in distribution here. It's electronically available. That message was in my inbox from yesterday. I thought it was very, very timely. And there continues to just be an increasing and enormously important amount of work. Mary Jo mentioned the center, and Barbara Brandt has had the opportunity to address us before. She came to a meeting of the Federation of the Associations of the Schools of the Health Professions, FASHP, earlier this spring to outline the immediate work plan and organizational structure. We're pleased that as president of FASHP and as a key leader in the Interprofessional Education Collaborative, Steve Shannon will serve in a key liaison role with the National Center to make sure that that which we do here organizationally and there Minnesota and nationally remains in sync. Next week, we'll have the third Interprofessional Education Institute for Faculty Development. It will be out in Herndon at the Dulles Hyatt. And once again, as were the case in 2012, the Institute is oversubscribed. Faculty and institutions around the country are really hungry for faculty development, and Kathy's shaking her head. This one is focusing on quality improvement and patient safety as a focus for interprofessional education and collaborative practice, building upon the work also funded by the Robert Wood Johnson Foundation on quality and safety education and nursing, and a lot of work that's also been done at AAMC. As I mentioned, that was oversubscribed, and so we've recently committed to hosting 3 more institutes, one in the fall of 2013 and at least 2 in the beginning of 2014. Dates, places, and the focal point of those institutes will be released soon, but haven't been released yet, and we'll get those dates and topics out to the broadest interest. We do believe that we'll do the one in the fall in Chicago, and it will go back to being the fundamentals of interprofessional education that we devoted the topic to in 2012, and then at least one of the 2 2014 institutes will focus on patient safety and quality improvement again. We're very, very interested in the assessment work that's unfolding because everybody wants to measure it, including Scott Reeves, who is the co-chair of the planning committee of the first 2 workshops last year, who I know just alerted us to the fact that the Cochrane collaboration has been updated on interprofessional education. That just recently has been published. And the good news is that there's a little bit more evidence that when you do interprofessional education, it improves teamwork and then translates into better patient outcomes, which at the end of the day is what we're all in this game really to accomplish. But now we've got the luxury of almost 30 minutes of time for Q&A before we move to the next session. And I wanted to mention before I call on Aaliyah to mention to the people who are in the conference space next door that if any of you do have a question, we would invite you to come on in so that you can stand at the microphone so that we not only can see you but also can hear you and have your questions for the broader audience following us today. So can I ask for the first question?